For people who are nervous about the sedation itself, can you just give a little explanation as to what they might experience, like when they get it? How long does it take to start working? When does it wear off? Dr. McCawley, you want to start?
Well, first of all, we're not using general anesthesia. So it's what they call conscious sedation. So you're sleepy, but it's super safe because of that. It's no different than taking a Valium or a pill that relaxes you. Only we do it's much more predictable because we give it by vein. So there's nothing to fear from the procedure. And as sometimes they're a little afraid of they've had multiple needle sticks, but Dr. Nemeth has actually turned us on to this device called the vein viewer, which allows us to get the vein the first time virtually every time.
That's true. This vein viewer, by the way, it's very interesting. It uses infrared light that is a shallow penetrating infrared light to find the veins. We actually rarely use it because normally we're able to see the veins relatively easily and we don't need this. But for some patients who have a lot of adipose tissue or a lot of fat, we may need to use something like this to find the vein. And this will look right through the patient's skin and show, well, maybe I can demonstrate this on the back of my hand here even. Let's see if we can get this thing going. Since I don't really know how to use it.
It's a red button.
My assistants turn it on. Why don't we turn that? Can we turn the light off for a minute? So if you look here on my hand, you'll see the veins quite clearly.
It's amazing.
And so we can see where these veins are. They may not be visible to the naked eye, but this infrared light penetrates through the superficial layers of the skin and enables us to find veins wherever they are. And
so people who have difficult to find veins, we can use this you can see the veins there. So it's really amazing. It allows us to get the vein virtually every time. So there's nothing to worry about that either.
Yeah, I kind of feel like what you guys have done, which is so neat, is solved some of the fear issues that us, patients have. One of which is being pricked with the needle and not over and over and over again. And so this minimizes that possibility of you, and you both use that tool, obviously.
And another thing that will minimize pain, and that's Dr. McCawley and myself were the first, not just periodontists, we were the first periodontists and dentists, and we were both periodontists. We were the first in the country to own the first dental laser. Now, we keep arguing back and forth. Tom, was it you or was it me? I mean, I know it was me. He knows it was him, but we were the first two, that's for sure. And the dental laser has made treatment so much more comfortable, so much, there's virtually no bleeding with the laser. We can accomplish so much with it. Again, and it's minimally invasive. We have 5 or 6 different lasers here at the office. I know Dr. McCawley has a number of different lasers, and that has revolutionized our practice. And Dr. McCawley has told me about a number of courses, where lasers are used. And I've told him about some, and we take a lot of these classes together. But we probably have more laser experience than...
It's almost without a doubt that Dr. Nemeth and I have done more laser procedures than anybody in the world, because we had the first one, and we've been using it almost every day now for over 40 years. So because of that, our experience, you get better at it. So somebody who's just starting, so we're experienced at it. We know how it works best. So we're actually the most experienced in the world. We had the first one, and I calculated I've done over 6,000 procedures, and Joe has probably done 10 or 15. So there we go.